This lecture, we are going to talk about the dysfunction of endocrine pancreas. So after this lecture, you should be able to describe the definition of diabetes, the different type of diabetes. We should also be able to understand what is oral glucose tolerance test and what is the diagnostic criteria for diabetes. So first, the definition of diabetes. The diabetes is a group of metabolic disease. Those diseases are actually characterized by hypoglycemia. And those hypoglycemia can resulting from either a defect in insulin secretion or insulin action, or can be both. We are going to discuss each part separately in the lecture. So first, let's talk about different type of diabetes. Diabetes can be now there's four definition. There's four different type of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes, and the specific type of diabetes. So type 1 diabetes, the mechanism of type 1 diabetes is usually caused by autoimmune beta cell dysfunction. We're going to spend some time in the next video discuss the mechanism of type 1 diabetes. Because it's caused by autoimmune beta cell dysfunction, so the insulin status is absolute insulin deficiency. However, on type 2 diabetes, because the beta cell dysfunction is a progressive, it's not acute, right? So the insulin status is they are usually insulin resistance. Insulin resistance means the actual plasma insulin level are higher, are much higher. Gestational diabetes is usually occurred in pregnant women on their second or third trimester. Those pregnant women, they usually have diabetes before pregnancy, but they don't know they have diabetes. And the status of insulin is usually insulin resistance as well. The very last type, specific type of diabetes, there are several types. Okay, so one of the specific type is MODY. MODY is called maturity onset diabetes of the young. So this is a genetic disease. It runs in the family, and the diabetes occurs in a very young age. The mechanism of this is not clear. It's mainly related to the GLUT2 receptor deficiency. So that's MODY. We won't spend too much time on this. Another specific type of diabetes include cystic fibrosis. On the cystic fibrosis and the stage, pancreas was destroyed. Drug-induced diabetes, for example, if patient was given glucocorticoid for a long time, they may have diabetes. So this diabetes is called drug-induced diabetes. So what's the normal fasting plasma glucose level? When we diagnose the diabetes, we usually use the fasting plasma glucose level. The fasting blood glucose level in a healthy person is usually less than 100 milligram per deciliter. However, if the fasting blood glucose level is smaller than 126 milligram per deciliter, you can diagnose the diabetes. However, between 100 to 25 is diagnosed with pre-diabetes. So another term I should introduce is we are going to discuss is the glucose tolerance test. So glucose tolerance test is a test that you ask the patients to take usually around 100 grams of glucose. So after patient takes the 100 grams of glucose, you measure the glucose concentration between 1 to 3 hours. Okay, it's usually like after 1 hour and then the second hour and the third hour. The higher glucose level indicate it's diabetes. So the oral glucose test is usually used to is usually used to screen for gestational diabetes. And the reason we use this is by looking at your body's respond to glucose load. Use this to make a diagnosis of diabetes. So another term we should understand is hemoglobin A1C. This is used very commonly in clinic. And so hemoglobin A1C in diabetic patients, a very small portion, a very small fraction of hemoglobin is glycated. So that means glucose can bind to alpha or beta chain of the hemoglobin, but it's in a very, very small portion. And this small portion, this small fraction of the hemoglobin is called hemoglobin A1C. Again, it's different from plasma glucose level because the hemoglobin A1C is pretty stable. It's usually it do not reflect refluctuate a lot like glucose, right? It reflects the average glucose level over past 3 months. In a healthy person, the subtraction of hemoglobin A1C is really less than 5 to 5.7%. But if an individual who has more than 6.5% of hemoglobin is hemoglobin A1C, then that's the indication of diabetes. Between 5.7 to 6.4, that's can be diagnosed with pre-diabetes. Sometimes we use hemoglobin A1C to make diagnosis, and the most important thing is we use this to monitor the therapy, the efficiency of the therapeutic, the efficiency of the therapy, because it reflects average glucose level over the past 3 months. The higher value equals the worse control of blood glucose level. So now, finally, what's the diagnostic criteria for diabetes? We should memorize this. For any person who has hemoglobin A1C more than 6.5%, or if the fasting blood glucose level was more than 160 milligram per decimeter, or 7 millimole per liter, the fasting means fasting is defined as no calorie intake for at least 8 hours. We can also use the OGTT test. So during OGTT test, if 2 hours after glucose load, it was more than 200 milligram per deciliter or 11.1 millimolar per liter, it's also reached the diagnostic criteria. Or individual with classic symptom of hypoglycemia crisis. If a random glucose level is more than 200, that's also meet the criteria for diabetes.